weave all of these components together.
Have you thought about, or do you, in many counties, connect with adult ed as well as the community colleges? And actually, okay, that's good. We're having a hearing on adult ed tomorrow morning. Okay.
So you'll be immersed, Senator. Senator McGuire.
Thank you so much, Chairwoman, and do appreciate the four of you being here. Would like to be able to ask three questions. First is to Ms. Schott. I'd like you to just take on the 24-month policy real quick and ask your personal opinion if you think it promotes long-term success for clients.
The first 24-month part is
Absolutely does,
yeah,
but
yeah.
as far as the hard
the broader services in the first 24 months, the appropriate services, absolutely. The inflexibility of saying when you hit the 24 months with limited exceptions, you can't get the appropriate services. No, that sends the most vulnerable families, instead of to better economic futures, to actually to worse economic futures than they would be at otherwise.
Appreciate that. Thank you so much. Mr. Ansel, thank you for being here. Would like to be able to check in on the status of the Family Stabilization Program in LA, and how many residents have you been able to enroll into the program?
So I don't have a precise number with me, but it's very small relative to the number of families we're serving. And as I mentioned, we have formally implemented, and we submitted our plan to the state. We've issued instructions to our staff, but absent the new assessment tool, our staff have not been essentially assigning CalWORKs parents to family stabilization. They've been offering family stabilization, but based on the way it's been playing out, there hasn't been a take-up rate there. But again, what I want to say is that with the exception of mental health services to children, every specific service that's available in family stabilization is available without family stabilization. Mental health, substance abuse, domestic violence services, learning disability, and a wide array of locally implemented services to combat family homelessness among CalWORKs families. So all of that is available. So the delta, if you will, between non-family stabilization and family stabilization in our county is a more intensive case management and a more holistic relationship to the family, as opposed to a distinction in the tangible services that are available, with the exception of services for children's mental health. And it's for that reason that, at least in our county, precisely because we have such a broad array of very well-developed other services, that the absence of the assessment tool has had this effect of very low numbers of families enrolled in family stabilization to date.
Okay. Personal opinion, I don't know where your board is at on this, but just on personal opinion, I guess the piece, and I'll share my bias, and I think I've already done that in my opening, is that the 24-month time clock, the hard out, if you will, is a real challenge. So I want to just talk about your personal opinion on that 24 months.
Well, Senator, our board does not have an official position on the 24-month time limit, and therefore neither do I. However,
as a professional who's been in the field.
However, what I can share with you, as I indicated in my testimony, is that our understanding of the policy package adopted by the legislature was that the 24-month time limit was tied to 4 other significant changes in the program. And as we sit here today, one of which was not so significant, which was the change in the required work hours from 32 to either 20 or 30. So that left 3 really significant changes in the program: flexibility in the first 24 months, the holistic assessment tool, and family stabilization. The most important from our view is the assessment tool, which hasn't been implemented yet. And as I've indicated, at least in our county, there's a very close relationship between the assessment tool and family stabilization. So I would parse your question in 2 ways. On the underlying question of whether having the 24-month time limit is a good idea, I'm going to pass on that and defer that as a matter of policy to the legislature and the governor.
That was a
But-
good punt.
But on the question of the timing of when that clock starts to tick, it started to tick in January 2013. This is March 2015, and the two most important changes in the program have either not been related link changes have either not been implemented at all in the case of the tool, or derivatively to a very limited degree in family stabilization. So I would just observe that in the context of the package of changes that it seems from a petitioner standpoint that the legislature and the governor agreed to, and say that aside from the underlying policy question, I think there is a significant question about whether it makes sense for that clock to have started ticking in January 2013 rather than at some subsequent date.
And I was
Mr.
just,
Mecca?
go ahead.
Are you gonna, I thought Mr. Mecca was gonna respond as well.
So when the 24-month time clock was proposed, there were no white papers that the county welfare directors had drafted that said we really need to shorten the time limits. And when it went on the table, nobody said, "Hey, that's really good. We should cut the time limits." It was we were concerned, and we continue to be concerned. And you know, sort of official positions notwithstanding, collectively, generally speaking, the Human Services directors view it as a big challenge, and certainly not anything that we desired you to do.
That's clear.
And again, I think it's, and not want to put words in the mouth, it's, and I'll continue to use that cutoff without having the tools, and I think there are different definitions of committed that we're committed to ensure that you're going to have client success. And so there's a significant challenge of being able to even roll with the 24 months if all the tools in the belt have not been provided. And as we heard from the senator earlier, is that is it fair and equitable if that commitment was not followed through upon, particularly to be able to start the clock? And that's been, I think, the challenges of many of us today in wanting to be able to provide those resources. Again, thank you so much, and again, really appreciate your time.
Senator Stone.
Thank you, Madam Chairman. It seems to me that maybe I'm wrong, but the 24-month moniker was maybe in response to $1 billion taken out of the program over 4 years. It was more of a fiscally derived decision rather than a practical decision. Is that fair to say?
I suspect so, from having been around, but I wasn't part of any of the intimate conversations when it was negotiated.
And I would
In
assume.
defense of the department, I will speak for Will Lightbourne. Here's my Will Lightbourne hat. I think he would say no.
Yeah.
I think others would disagree.
Right.
Fair, Mr. Lightbourne? Okay.
And I think it's fair to say that our county representatives, if there was enough money to extend the program to 4 years, you would probably be very supportive of that, I would imagine, as long as we had the items that you suggested as recommended, repeal the maximum family grant, increase grant levels, bring back the earned income tax credit. So I have a few questions. Maximum family grant for a guy that's kind of new here in the legislature. Is it different from county to county, or is it the same throughout the state?
It's a statewide policy that was actually enacted prior to welfare reform, based on the absolutely disproven and faulty notion that getting a small increase in a welfare grant when you conceive a child on aid contributes to fertility. What we've found that it has done is just consign a generation of kids to deeper poverty and has absolutely no effect on reproduction, fertility, the likelihood that people have more children when they're on aid.
Okay.
Might I add that in Los Angeles County, there are over 40,000 maximum family grant children who live in deeper poverty as a result of that policy. And not only do they live in deeper poverty, but their parents and any siblings also live in deeper poverty as a result.
So a person receiving the maximum family grant in LA County would be the same of somebody in Riverside County getting a maximum family grant?
Senator, the way the policy works is that if a child is born to a parent 10 or more months after the parent began receiving CalWORKs, then that child is ineligible to CalWORKs. So what it means is that, for example, if it's a mother and 2 children, one of whom is subject to the maximum family grant rule, regardless of the county where the family resides, that family will receive a grant based as if there were only 2 people eating or needing shelter or needing clothing in that family, even though there are actually 3.
Understandable. So if you have a single mother, 2 children in LA County, same in Riverside County, the grant amount to each of those families is the same.
So I think it's a semantics issue.
What I'm trying to discern is that the housing costs in Los Angeles County are significantly higher than Riverside County.
They're talking about family cap. It's called maximum family grant. So I think, correct me if I'm wrong, Senator, the senator's trying to get to not MFG rule, but the maximum
The maximum aid payment.
aid payment county by county.
Yes.
Fair enough?
There, in California, there's a 2-tiered grant structure for higher cost counties and lower cost counties, and that is intended to somewhat reflect the difference in housing costs.
Okay, I'm happy to hear that. I was a little concerned it was flat.
It's a fairly
amount
blunt
throughout the state.
instrument, to be honest. The difference between the 2 grant levels is not that large, and there's an awful lot of variation within the counties among those 2 categories. So it's certainly not by any stretch of the imagination a precise way to try to sort of calibrate grants to housing costs.
I'm sure the disparity in housing costs is certainly not proportional to the difference in funding in both of those.
And if I could
programs,
say, I just want to underscore something that's been said. California has such a disproportionately low number of people that have HUD Section 8 vouchers compared to many people in other states. So when we compare the number that you quoted, the 10% of the population, 30% of welfare, it's really, they're not easy comparisons, and they're probably not fair because in some of those states, a much bigger percentage of their TANF cases are getting Section 8 vouchers than people in California. And it becomes a huge factor for us in trying to keep people from homelessness because obviously homeless people have an extreme difficulty. I don't know how any of them possibly sort of make it through life, never mind making it from welfare to work.
Has your association taken a study of what you feel the appropriate formula should be to beneficiaries?
You know, it's very difficult if you're talking about calibrating individual grants to a particular client's housing cost. I don't know that it's viable because you have such variation, even like within a neighborhood, within a county, within a zip code, you could have some people with high grants and some people, or higher rents and some people with lower rents. What the housing support program allows us to do is sort of individualize, and customize the type of assistance that we give to people who found themselves falling into homelessness. But I think it would be a really difficult task to try to calibrate the grants to someone's actual housing costs.
Okay. And then lastly, I think one of the speakers before was talking about the investment in people that are in the welfare to work program and the disproportionate amount of, or I should say, increase in homelessness among those populations. And maybe maybe there's a nexus. Maybe you can tell me, is there a nexus to the abolition of redevelopment, which, as you know, 20% was set aside so that we could build low to moderate income housing? What impact has that had on that increase in homelessness?
Senator, I was the one who cited the enormous increase, almost a tripling of the number of CalWORKs homeless families in Los Angeles County since July of 2006. Whatever impact redevelopment has had, or the ending of redevelopment on the construction of new low and moderate income housing, would have been only felt to a quite limited degree over this arc of time, just because of the timing of when redevelopment was terminated in California and how long it takes to build new housing. The other thing I would say is that CalWORKs families are not low income, they are super low income. So that oftentimes, even in the affordable housing that was developed with redevelopment dollars, in many instances, CalWORKs families were not able to qualify for that. So what I would say is that at least at this moment in time, looking at this number of years, that I think it's very unlikely that the suspension of redevelopment is any significant contributing factor to the enormous increase in the number of CalWORKs homeless families, and that the much greater cause is the continued flat grant levels, which are much lower than they were in real terms than when CalWORKs was enacted, exacerbated by the maximum family grant.
I do think I'd like to add, though, your question was specific to whether or not the abolition of redevelopment was a driver or a cause of CalWORKs homelessness, and I don't know if that's the case. The absence of affordable housing is absolutely a barrier to the solution for CalWORKs recipients. So,
Agreed.
The county, we talk to the 20 counties that receive the housing support program funds every couple of weeks. How's it going? What are the barriers that you're facing? And the number one barrier is actually trying to find the affordable housing. And we worked very closely with Housing California when we brought this program up, and they've helped educate us a little bit on the affordable housing issue. And I think they would say, I think the representative is here, that some type of stable revenue source to develop affordable housing would really benefit the state, because we're seeing it in child welfare, we're seeing it in CalWORKs, we're seeing it in aging programs. Across the board, our inability to find people a decent, affordable place to live is undermining the outcomes that you want us to achieve.
Thank you. I appreciate your comments.
Thank you, Senator Stone. 15-second final word. Anyone on the panel? If you want to respond to something that a fellow panelist said, something you want to drive home. Ms. Lytle.
I just have one thing. I think it is imperative that the housing allocation is increased. If it is not, we have counties that do not even have it. So there are children in the state of California that are still homeless. And I think increasing that will allow other counties to house those families, and it will keep the counties that are using it already to do so also.
Thank you. Mr.
What she
Mecca.
said.
Got you. Mr. Ansell, can you tell us as an example, if you know it, the Section 8 LA County wait list timeframe?
It is my understanding that it has been upwards of 20 years.
Thank you. 30 seconds.
Stabilize the program. Repeal the maximum family grant. Increase the funding for the housing support program.
And thank you for your fresh eyes on the language we use, Senator Stone. So we probably should say maximum family cap, because I immediately realized where he was going. Maximum family cap is what you're talking about. Thank you. Ms. Schott.
Agree with what everyone said. I'd like to draw your attention to some of the attachments to my handout that I really didn't get to go to, including the last page, which has some really detailed things about some intensive case management services programs.
As well as the examples you've given, New Haven Moms Partnership, Crittenton Women's Union Mobility Mentoring, Ramsey County, Minnesota Workforce Solutions.
Right.
Thank you very much to the panel. We appreciate it. Thank you. With the hour of 4:35 having arrived, Senator McGuire and I are going to drive this train home. So will the last panel please come forward? At the top of the hearing, Senator McGuire reminded everyone that panelists would have 5 minutes. The public would have 3 minutes for their public comment. And given the size of this panel, we're going to do a better job of asking you to confine your comments to the 5 minutes. Is that fair? Is everyone okay with that on the panel? Trust me, I'm looking at the eyes of the people in the audience. I think they would appreciate it also.
Yes, Chairwoman.
As you two probably will, since you all have been here the whole time. Before I punt over to Senator McGuire, I want to make sure that I don't do what I did in the last panel and get you out of order, because some thought and planning went into this order, so I should honor it. So I'm just going to read the order. First, we're going to hear from Alfonso Quiros, Ventura County Employment Specialist. Then we're going to hear from Tia Orr, Senior Government Relations Advocate, SEIU. Stephen Goldberg, Senior Attorney, Legal Services in Northern California. Vivian Louise Thorpe, Legal Advocate, Homeless Action Center, Berkeley. And finally, Jessica Bartholow, Legislative Advocate, Western Center on Law and Poverty. Thank you, Mr. Quiros. We'll begin with you.
My name is Alfonso Quiros. I'm from Ventura County, and I'm an Employment Services Case Manager. I'm here to discuss SB 1041 implementation and Family Stabilization Act. The Family Stabilization Act.
And thank you for taking time out of your work today to
You're very
spend
welcome.
all this time, all these hours this afternoon to come and educate us about your workload.
My pleasure. Thank you so
It's duly
much.
noted that you're away from your desk today to come here, and we appreciate it.
I'll make up for it tomorrow.
I'm sure.
That's okay.
I'm sorry.
That's okay. Anyway, back to what I was leading to is the implementation of the SB 1041 Family Stabilization Act and how it has affected my services to the population that we deal with. With the implementation of the 1041, amongst numerous other programs that have occurred in the last 2 years, my time for our population, our clientele, our participants has greatly, greatly diminished. I sat in the back and I listened in on our colleague from Yolo County, and I thought, wow, this is 10 years ago.
Yes.
That's perfect. That's the way the program should work.
Right.
The case management overall is needed. I can't say it would bring 50% WPR, but it would bring a lot of smiling faces and greatly help out the population. In the last 2 years, once again, numerous occasions in dealing with my initial assessment with our population, that it's been hard for me to spend the necessary time that is needed to thoroughly assess, evaluate, and appraise not only our participants' needs, but also their families. I don't feel like a case manager any longer. It's all about data entry. It's all about statistics. It's all about numbers. We have to do 50%. We have to do this. We've developed, I'm going to say, 8 to 9 reports that we have to monitor either on a weekly or monthly basis. Statistics, for what purpose? I understand it's needed, but it's beyond me how that's going to help our population. We used to have quite a lot more time to address our clientele's needs, as once again my colleague mentioned. Now to me, it feels like we're just herding them through the they're just numbers now. They come in, we do a quick assessment, and they're off to their first activity. I'll talk a little bit more about that in a minute.
Okay.
In my county, Ventura County, first activity for our population that at the time of appraisal is not enrolled in a vocational education program or employment is the job club. So without saying anything further, I'm sure you all know what a job club is. Yeah. So, job club. They have no idea what it is. They don't know what a job club is. They're afraid to come in to meet me, and now I'm going to send them to meet a teacher and potentially stand up in front of a group of people and discuss what's going on in their lives. That's a scary thought.
Right.
Scary, scary thought. In my county, once again, the job club is the mandatory first activity. Whereas before the SB 1041, we have more flexibility to address needs and concerns for the clientele and their families. My own statistics, I would say 80% of the population we serve doesn't even have a high school diploma. And yet we're telling them application, resume, employment portfolio, find a job. I don't know when, once again, using McDonald's has ever requested an employment portfolio for someone to obtain a job there. Second of all, Computer skills, if they don't have a high school diploma, sure, they can surf the web, but to develop a resume, an application, it's not going to happen. I'll be more than happy to help them. They're not going to know what I wrote on the resume when they go in to show it to the prospective employer. They have no clue. They have no clue. That leads me, what I've heard, family stabilization program. I think once it's implemented fully, it'll be a great tool. Why? Because once again, it sounds like Yolo County is doing that with every one of their cases. Intense case management like we used to do. Focus on barriers of not only the participant, but the families. We have the money, we have the funding, it'll work. So I'm really, really strong on this family stabilization program. Once again, I hate to say it, but without the proper training, our population won't be successful. We may get them off the rolls for 1 or 2 months. All of a sudden, they call in sick because they had to take their child to the doctors and using McDonald's again. They're not going to let them, they're not going to forgive them for missing the 4-hour shift. They come back, they don't have a job. Allow us to do the work that is on our actual job description. Let us do, when we applied for this position, the job description is nowhere near to what we're doing now. It limits our ability to help. We need to focus on our clientele, and hopefully this will allow us to reach our ultimate goal, which is self-sufficiency. Thank you.
Thank you very much. I appreciate that. Ms. Orr, 5 minutes.
Okay. Good afternoon, Madam Chair and members. Thank you so much for having us today. First, I would like to thank the committee. I think it is admirable that county client service workers and county employment service workers have been brought to the table to share their opinion and their experience in this. I believe that their experience, along with everybody else that spoke here today, is invaluable, and I think that we can hopefully inform the process to improve this program. The first thing I'll say, and I'll try not to be redundant, I know time is of essence here. Obviously, there was huge changes in the programs that I think turned the program on its head, right? There were cuts to the program, demand increased beyond what we knew. There were lines outside of the doors at the same time, right? That diagram that CWA put together is mind-blowing, right? Because every box in there is a change that not only clients had to experience, but the workers had to find a way to implement. And I can't stress enough the importance of having trust with your clients. And to build trust, it takes time. And in order for clients to trust you, it takes confidence in you. And unfortunately, with the lackluster training, and no pointing fingers, but the training was insufficient for our workforce in this onset, that clients were asking questions that sometimes our workers couldn't answer. Clients were told that they didn't have to engage, and then told again, now we need you to engage. There's mixed messages that are being sent from workers to clients that at some point in time, I believe, impacts their trust. And in order for us to seriously engage clients and help them achieve self-sufficiency, I think that trust needs to be there. There was a time in the program, as Alfonso mentioned, where the time that a worker spent with a client was very enhanced, where a worker knew so many personal things about a client beyond their case plan, beyond meeting the WPR. I know this from experience, and I know this because I've seen people go through the program, including myself. So there was a period of time where the worker knew everything about your life. They knew about your kids. They knew your kids' names. That, to me, is the idea of enhancing engagement and enhancing the ability to get people to work faster. I think it's unique and almost troubling to SEIU and I think others that we propose to enhance engagement. We propose to enhance front-end services to get people jobs sooner, but yet we're spending less time with clients. One would think that in order to do that and to meet that goal, which I think is a great goal, universally we think it's a great goal, to achieve that, there needs to be enhanced time, more time spent, less reporting, less paperwork, more engagement, right? And we've heard from some of our workers, and you'll hear from today, there was moments that after the 24 months, they continue to engage. There was a point in time in the CalWorks program that was done. And I think if we all put our heads together and look at best practice, look at past practice, put everything together to one complete program, we might be able to achieve that. The reality is there's workers out here today that are carrying 200+ cases. So I would respectfully disagree with some of my colleagues in that workload is not a problem. I believe it's a huge problem. I believe that you, the legislature, have made very concentrated and welcoming investments to the program specific to employment services, but I don't think they meet nowhere near the necessity to meet the goal that was stated by the 24-month implementation. So I would recommend on behalf of our workers across the state that we look at best practices. We look at continued investment. We repeal bad policies like the MFG that make absolutely no sense with the nature and the goals of our program. But I would say firsthand that trust is an issue. Establishing the relationship is an issue. Making sure that workers are trained is a #1 issue, and making sure that workers are brought to the table to talk about the issues that they're having. One thing I would like to mention as well, the counties did a great job during the recession in working to preserve staffing. They did an amazing job because we lost a number of workers, but nowhere near as many as we could have due to the budget cuts that we had. What counties were able to do is shuffle some things around, create universal workers, where there's workers now that are not concentrated on CalWorks. They do all programs. In your county, they might be called generic workers. Good for senses of cost savings. Is it the best thing for service delivery? Do you want your eligibility worker that you talk to initially with front-end enhanced services to be a CalWorks specialist or a specialist on every program because it was better for cost savings? Counties also changed into a more task-based system where workers are no longer following a case throughout the whole process. They do a specific task on the case. So operationally, cost savings, yes. Is it the best for service delivery? It's something that we might need to look at. So in closing, I would say a couple of things that we would suggest, because obviously suggestions are helpful when you come out of these hearings, is 24-month time clock is not, it doesn't make sense to us. I'm just going to be straightforward. We can talk about how to improve this 24-month time limit, but we would say that 24 months is not long enough, even with enhanced services, for us to be able to remove people from this program in a self-sufficient way. Invest in the workforce, train frontline workers, look at changes made operationally in order to deal with cost savings and see if that's the best path. And the last thing I would say, and I'll close, Senator Mitchell, is believe that these CalWorks clients are worth more than a minimum wage job. And if that's our ceiling, then we're doing a great job. If that's not our ceiling, that they can be doctors and lawyers and lobbyists, and they can be people that make 50, 60 union working salaries, right? Then we should try to achieve that.